So we'll just make some introductions and then we can start. So good
Okay.
evening, everyone. Thank you so much again for joining us for today's monthly meeting and webinar. Today we have a very interesting and slightly unconventional but yet important topic to discuss. The title is Beyond the Operating Room: Lifestyle Medicine for the Surgeon's Well-being and Performance. We're honored to have in our midst Dr. Moyosore Makinde, who is a consultant family physician and also a lifestyle physician. She's also a president of Nigerian Society for Lifestyle Medicine, and she'll be presenting to us on this very important topic. So, as usual, we'll have questions and answers at the end, and this meeting is being recorded and will be on our platform shortly after being edited. Without further ado, I'll hand over the stage to Dr. Makinde.
Thank you very much. I'm very honored to be here this evening. I want to say good evening to all distinguished surgeons in the house. And it's a real privilege for me to share on this important topic, beyond the operating room: lifestyle medicine for the surgeon's well-being and performance. And of course, we know that lifestyle medicine is not just for the surgeon, it's for all physicians, it's for everyone, we and our families. But once we're able to engage ourselves in healthy habits, as we'll be talking about tonight, it will be easy to take it home to our families. It will be easy to even take it home to our patients, because we even have surgeons who have special interest in lifestyle medicine, and it makes all the difference, when it comes to the outcomes of our patients after surgery. So we'll be looking at these objects. We'll look at the health behavior or the lifestyles of doctors in general, and we'll talk about some of the factors that undermine healthy lifestyles, and we'll introduce lifestyle medicine approaches that would help us to optimize our health and reduce burnout. And of course, we'll talk about some of these benefits. I would like to start by saying that a healthy lifestyle is a way of living that lowers the risk of becoming seriously ill or dying early. And this is from the World Health Organization. This is a very important quote, because I'm sure we are aware of some of the morbidities and mortalities that have been occurring in the lives of our colleagues, especially in recent years. We've heard about colleagues slumping at work, becoming prey to some of the chronic illnesses that none of us really would want to have. But we find out that many of our colleagues, many of us are now coming down with chronic illnesses such as hypertension, type 2 diabetes, even some cancers. And we are the ones who are trying to heal patients, and yet we are wounded. And some persons have referred to us as wounded healers, because we take care of people, but we end up not taking care of ourselves, and we end up becoming ill. So surgeons often heal others, but they neglect their own health. And we're going to be asking ourselves some very pertinent questions today, and that will help us to know whether we are actually taking care of our health. So we undergo a lot of physical demands, both physical and emotional demands, especially for those of us who are really into our patients. We want to see them get better. We take all the time, to learn, to acquire skills, to study, and to bring ourselves up to par so that we can give them our best. But we find out that at the same time, though we are saving lives, we end up burning out, and fatigue, is common. And the truth is that we cannot pour from an empty cup. And so lifestyle medicine actually will offer the tools to restore vitality and enhance longevity. And at the end of the day, we'll be able to add life to our years, and as well as years to our lives, so that we can perform better and also live better. So there was this study that was carried out among surgeons and surgical trainees. It was a systematic review and meta-analysis. And what was discovered was that there was a lot of high stress discovered among surgeons as well as trainees. At the same time, there was low recovery, from those people who were engaged and had high stress levels. We are going to be talking today also about stress levels and how, we can manage them. But it's very important to know that the overall prevalence, the post prevalence of burnout, from this study was about 47%. That's quite high, and across specialties, the burnout rates ranged, it was a meta-analysis, so from 15% to 77%, depending on the surgical field. And there was a variation depending on whether it was ENT specialty or pediatric specialty. I didn't really get the one for colorectal surgeons, but people who were in the pediatric specialty, they had lower rates related to other fields. And people with who were involved in ENT surgery, they had the highest burnout rates. And very importantly was that 30% of surgeons experienced chronic sleep deprivation. And of course, this can lead to reduced focus and higher errors, higher rates, of errors. Now, let's look at some other studies that talk about personal health behaviors among medical doctors. We have evidence that supports the lack of consistent practice of health behaviors among doctors. And what are these health factors that we're looking at? Stress. So on a general note, even we're not talking about surgeons here, we're just talking about doctors in general. It was about 53%. How about doctors who were not engaged in any form of physical activity or exercise, or maybe it was just occasional? We have 35%. So it's one of the questions we'll be asking ourselves today. Are we engaged in physical activity, intentional exercise? Then how about sleep? Medical doctors engage in 6 or fewer hours of sleep, just about 30, that was 34% of doctors. And then 27% never or occasionally ate breakfast. And 30
It looks like we've lost our
We
speaker.
lost the volume. Yeah.
Dr. Makinde, can you hear us? Hello?
I guess she has some connection issues. We'll just give her a minute or two to rejoin us. Apologies for the inconvenience.
Sorry, you lost me, or I lost you. Let me share
We lost
again.
ourselves.
Okay, I tried to change my network provider, so I hope it shouldn't stop now. Okay. So I was talking about personal health behaviors among doctors, and this was a study that was done by Madaki et al. And it found out that 65% of doctors engaged in harmful behavior. Some of this included lack of exercise, like we mentioned earlier, inadequate sleep duration, and then preference for soft drinks. I want to believe that this is common among surgeons. You're on the go, you're in between surgeries, you probably didn't have breakfast, and the next thing is to reach out for a bottle of Coca-Cola. And we'll look at how this can actually affect our bodies, and lead to inflammation and disease. Of course, alcohol use also is something that is found among some of us, as well as cigarette smoking. So the fact that we are physicians, it doesn't actually mean that we're healthy. It doesn't mean that we'll make healthy choices, because individuals are not much different. Whether you're a surgeon, you're a physician, you're a regular person on the streets, studies have shown that the prevalence of the preventative health factors and lifestyle factors are actually similar among healthcare practitioners and people who are non-lifestyle or non-healthcare practitioners. So this was another study that looked at the behaviors of healthcare workers. And the question was, do healthcare workers practice what they preach? So when they looked at the numbers, they discovered that healthcare workers were more likely to have a personal physician. So this is for healthcare workers. I think we'll also look at physicians. They were also likely to have had a checkup within the past 2 years, and they were likely to have exercised within the past 30 days, and they denied recent or heavy or binge drinking. So this was a study that was done among these healthcare workers. So, but it was now discovered that there was really no difference between healthcare workers who would choose to have a pap smear or go for a dental test or go for a sigmoidoscopy or colonoscopy. There was no difference in being overweight or obese. There was no difference when it came to smoking or using smokeless tobacco, engaging in risky behaviors, being dissatisfied with life. So there was no significant difference between healthcare workers and lifestyle medicine practitioners when it came to some of these things that I've listed. So the question is, these preventative health behaviors and the lifestyle factors that were assessed, how different was it? Were health workers practicing what they preached? So now I think more importantly is to bring it home and to ask ourselves, and maybe we can put that in the chat box so that we can actually see how well we are doing. And let's ask ourselves the first question: do you have a personal physician? So if you have a personal physician, you can put a yes in the chat box. Another question is, have you exercised in the past 1 week? Are you up to date with your pap smear or dental visits? Have you ever had a sigmoidoscopy or a colonoscopy? Are you overweight or obese? How often do you drink and how much do you smoke? So of course, we don't have to answer all these questions, but I'm really interested in how many of us, have a personal physician. Another important question is, what time is your latest meal of the day? Some of us as doctors, we tend to eat very late. Some people eat by 8 p.m., 9 p.m. And of course, we will not burn those calories. They tend to segregate, around our intestines and also within the liver, giving us a risk of fatty liver disease. Then daily consumption of fruits and vegetables. How many of us actually intentionally make sure that we have vegetables on our plates? And do we engage in risky behaviors? Are we satisfied with life? So why are we even talking about healthy lifestyles or healthy behaviors among doctors and among surgeons? Of course, one of the things that would inform this is longevity, quality of life. Like I said, adding life to our years. But it's very important for us to understand that there are different things that affect our health and our well-being. One of them, the foremost, is adverse childhood events. So these go a long way to form the risk factors for developing certain predispositions. Sometimes isolation, sometimes abuse. These things are very important, not just in doctors, but also in our patients. Genetic predispositions are important, and what we call epigenetics, because we discovered that you can actually step up or step down the risk for developing a particular illness or disease based on our lifestyle. Your lifestyle is actually the trigger that will determine whether some predispositions will come up. There was a particular study that was done among sets of identical twins, and they randomized them to a healthy lifestyle, well, not just a healthy lifestyle, but a diet that was majorly plant-based. And then the other group of people were randomized to a diet that was just regular, just the regular food that people eat. Of course, this was in the United States of America. And at the end of the day, they discovered that the telomeres at the end of the chromosomes of those who were on the plant-based elongated, within the period. I can't remember whether it was 6 months or 9 months that they were on that study. At some point they said, this is not fair. It's not fair for us to have the other set of twins not being on that plant-based, diet. So those predispositions can actually change depending on what we eat, how well we sleep, our social connections, of course, health literacy, exposures to pollution, socioeconomic status, disparities or access to healthcare and lifestyle practices. All these are the health determinants, but there are some of these things that we can actually modify, that we are in control of. And the most important thing here is lifestyle practices. So in conclusion, when it comes to lifestyle among doctors, it is clear that we don't sleep well, we don't eat well, we don't exercise. Some of us, we don't pay enough attention, not because we don't want to, but because we're so busy. We lose treasured relationships. We don't make that phone call. We procrastinate on vacations. We procrastinate on spending time with our family. Some people resort to substances. A doctor recently told me how he loved, alcohol. He told me that if I came to his house, that under his bed you will see bottles of Heineken. You see, this person is a family physician, by the way. But at some point, when I tried to check on him, he told me that he had stopped drinking. Why did he stop drinking? Because his blood sugar went up and it was very high. So it's like he had to now start taking medication, and he was now very much concerned about his health. And so he stopped drinking. But we don't want to wait, before we make some of those changes. And of course, work-life balance is very important so that our families can enjoy us. So because we're human, and there is this adage that, oh, doctor, heal yourself. I've had people tell me that you're a doctor, you shouldn't be sick because you're a doctor. So we have that culture of, people saying, oh, you're infallible, and that if you pay attention to your personal health, it can be perceived as a sign of weakness. So it's very important that we prioritize our own self-care. In fact, we should prioritize self-care over patient care, and we should seek help when needed. We should not go through that pathway of avoidance, and denying that there's something wrong. We should be able to say that we have done what we need to do, and then we will be able to enjoy our work better. So poor lifestyles are associated with acute stress, associated with depression, dissatisfaction with life, burnout, suicides, non-communicable disease, and premature death. So we need to change the status quo and reduce breakdown and burnout physicians and doctors as a whole. There was this study that also showed that 3% of Americans had healthy levels of all 4 health behaviors. And what are the 4 primary health behaviors? Non-smoking, having a healthy weight, having 5 portions of fruits and vegetables in a day, and engaging in regular physical activity. So going away from here today, we want to rate ourselves, and we want to ensure that we engage in these primary health behaviors, because that can transform, our well-being. At the end of the day, behavior changes is the key. We have enough evidence to show that there is a strong link between our behaviors and stress. We won't be able to take the time to choose, those healthy foods. You just want to choose junk because you're in a hurry. So we need to control the rates, of all those things that we're doing so that we'll be more relaxed, we'll be more mindful. There's something that we call mindful eating. So our healthy habits can boost our mood. Studies have shown that if you reach out for for small chops, okay, I'm using the word small chops, but actually junk or flour-based products or pastries, it gives you this high, because glucose is going to rush into your bloodstream. The glycemic index of all those junk foods are very high, so they enter your bloodstream very quickly, and you feel a kind of boost in your energy or mood, but it's going to crash very soon, and you find yourself craving something else, craving another drink, or feeling hungry. But when we engage in healthy habits, we release endorphins into the bloodstream, which stay within the bloodstream for longer, and they are also associated with less inflammation, and they have antioxidating effects also within the blood. So as a doctor's well-being suffers, the patient's care is at further risk of being compromised. What suffers? We have more health problems, quality of life reduces, we have less engagement with family and friends, we are more likely to have errors. I've heard some reports, especially in the US. I don't know how often such things happen here, in Nigeria, but I've heard stories about a surgeon going into the theater and they carry out the wrong surgery, on the patient. What happens, or what would have resulted to this? The doctor is probably overwhelmed and has not been able to take time to look at the critical determinants of whether this person is the one to undergo this surgery or not. You can imagine someone's limb, the right limb or the correct limb or the correct leg being amputated, and the unhealthy limb was left, without being amputated. So we've heard such stories. So there's a higher likelihood of errors, when we don't engage in healthy lifestyle habits. Of course, relationships are also affected. So the message tonight is, surgeons, heal yourselves. Physicians, let's heal ourselves. We are the head of the health team. We are the health of the medical team. We provide both mental, physical, social, and emotional care for clients and surgeons, and for clients and patients. And this requires a lot of our time. It requires a lot of our energy. It's often draining and exhausting. So what are the approaches that we can adopt that will ensure optimal health and prevent burnout and premature death among doctors? So the root cause of disease is actually what provides a credible unifying theory of commonalities in the mechanisms leading to chronic disease. And I'm going to show us a diagram where we have a rate limiting step. So that rate limiting step shows you where you can bring in your lifestyle factors, lifestyle behavior that will truncate the possibility of one developing any of these non-communicable diseases, which is said to be responsible for 71% of all deaths globally. So what are the commonality of chronic diseases? So some of us have discovered that we have similar diseases, occurring in a set of people, or one person could have hypertension, that same person will have high cholesterol, that same person will have high blood sugar. So this is because of the direct influence by our diet, response to stress, the amount of exercise, the amount of love we have in our lives, the amount of social support we have, our mental well-being. All these things will impact on what we call the commonality of chronic diseases. So this will determine whether you activate the pathway to disease, which we call inflammation, and it could lead to overstimulation of the sympathetic nervous system, where you have a lot of adrenaline and corticosteroids flooding the system, and all of those things, when they are perpetually in the system for a longer period, they also could contribute to hypertension and type 2 diabetes. Changes in immune function and the microbiome, like I said before, and we'll still talk about the gut and how what we eat can affect our gut. Oxidative stress can actually be reduced when we have a good diet, when we respond better to stress, we have more love in our lives, and we have more support. And then apoptosis, this has to do with those cells that could cause harm, but they can be removed from the system, when we have these direct influences from our diet and other lifestyle factors. Angiogenesis and telomere changes, changes in genetic. The diagram I was talking about, you can see where you have the root cause of disease, unhealthy diet, sedentary lifestyle, high stress levels. So cohort studies have shown that these are the root causes in our microbiome. They can lead to epigenetic changes, they can lead to cellular stress and injury, and all of that creates chronic inflammation within the system and predisposes to all those chronic illnesses I mentioned. But at the end of the day, we have lifestyle interventions that are the rate limiting step and can nip all of these things in the bud, either before they cause the alterations within our genes and before they can cause inflammation. So we don't need to wait until we develop some of these chronic illnesses. So now, let's talk about physical activity, poor diet, tobacco use. So 80% of all premature deaths are attributed to these factors. So that's just for our information. And a healthy lifestyle affecting genetic expression at the end of the day would reduce insulin resistance. That means the person is less likely to develop a high blood sugar. It will provide antioxidants and reduce systemic inflammation. So we have some task forces that have established that tobacco cessation, increased physical activity, and dietary changes can reduce morbidity and mortality from cardiovascular disease, as well as cerebrovascular disease and cancers in adults. Why is this important? We can actually prevent, treat, and reverse chronic disease by adopting changes in all these areas. So even for people who have already developed changes, people who already have cancers, who already have heart failure, if they're able to stop the unhealthy lifestyle, we can actually get some improvements, that can be attributed to their lifestyle and not just medication or other medical interventions. I remember watching a documentary where a woman talked about how she was diagnosed with heart failure. And she said she was devastated because she had lost her mom, to the same illness. I think maybe the mom also had a cardiomyopathy and developed heart failure. And the cardiothoracic surgeon told her that, well, the only way surgery, and it was going to be very expensive. She couldn't afford it. And he now said something that, well, there's something that can help you. If you can go on a plant-based diet, you just might not need this surgery. Her coronary arteries were clogged, and that was what had resulted in the heart failure. And so she made up her mind to go on a plant-based diet. Of course, when we're talking about a plant-based diet, it means anything that is growing from the ground, coming from your garden to the kitchen, or from the farm to your table. So it's not going through the factory. And of course, it means that you're not taking something from the animal, like goats or cow meat. It even eliminates chicken and anything that is an animal. But when we're talking about lifestyle medicine, we're talking about a predominantly plant-based diet. So it doesn't really rule out meat completely, but how often you take some of those things is actually what is important. So we can control our modifiable risk factors by 30%, according to the World Health Organization. And this woman that I just talked about, within 6 months, her coronary arteries were free of plaque, and she did not need that surgery, and she recovered gradually and came out of heart failure. So these are things that are really possible. So let's define lifestyle medicine. Lifestyle medicine is the use of evidence-based lifestyle therapeutic interventions, which include a whole food, plant predominant eating pattern, regular physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connections as a primary modality. And it is delivered by clinicians who are trained and certified in this specialty to either prevent, treat, and often reverse chronic disease. So the woman I talked about, she was able to have a heart failure reversed. Of course, it didn't happen in 1 week. It didn't happen in 1 month. It was based on consistent, intentional therapeutic lifestyle changes. And this is a diagram that shows us the different pillars. So there are 6 major pillars. So one of the things that we need to do is to embrace these pillars. Each of the pillars contributes something, to our well-being. And when it comes to positive psychology, there's something that we call PEMA. So right now, a lot of people are leaving the country. People are not happy. People are dissatisfied with work. The work environment is not favorable. People are unhappy. But we discovered that if you practice positive psychology, even in that unhealthy environment, you can actually feel better about yourself. So you can nurture positive emotions such that even when things are not going so well, you are focusing on what has gone well and you're hopeful for something better in the future, because it's not everybody that can leave the country. And sometimes you cannot just change everything that is going on within the social, political climate, but you can change the way you think about things. And so positive emotions is actually very important, even when things are not going well. So this is a principle that's adopted in lifestyle medicine that can help us to engage, with our family, can help us to engage better at work. It can help to improve our relationships and can help us find meaning, and accomplishment. So you focus on what has gone well rather than what is not going so well. So what are some strategies by which we can incorporate wellness programs into the health setting, despite our being busy? So we can look for access to physical activity opportunities. We can join a gym. In fact, there's a particular gym now that you can join on the go, no matter what state you find yourself. Even if you are traveling, you can actually access that gym. I'm trying to remember the name. I can't remember the name right now. Maybe before the end of the presentation, I'll remember. But somebody has also talked about physical activity becoming mechanized. So you don't have to get on a machine, even though sometimes the machines are helpful. You can get on a treadmill. There was someone who made a presentation at a conference. It was American College of Lifestyle Medicine conference. And throughout his presentation, he was on a treadmill. His laptop was right there in front of him and he was on the treadmill. That was quite interesting. So, but there are different things that we can do. You can park your car a distance from your work area and decide to walk. For instance, sometimes I like to park my car somewhere where I can wash it, in LASUTH. I know I have to walk a bit of a distance, to the family medicine department. But I just tell myself, okay, a 10-minute walk will not be too bad this morning, because you might not be able to get all the 30 minutes at the same time. And you can take intervals between consultations, just take a break, try and take a short walk, maybe along the corridor, avoid sitting for too long, because studies have shown that a sedentary lifestyle is actually the 4th risk factor, for premature death globally. So, and then you can also take breaks. And during that break, have your bottle, carry your bottle of water everywhere. That's what I do. I try to pack fruits or nuts So because if you have packed your fruit snacks, or you have packed nuts, or a variety of nuts like almond nuts, cashew nuts, you have those things packed and handy, you are less likely to want to buy biscuits. You are less likely want to order for small chops or meat pie, or have a bottle of Coca-Cola. So those are things that we can do intentionally well ahead of time. It can be apples, it can be pears, it can be a cut of watermelon. You can pack it, or even a salad cut, cucumber, cabbage. You can just carrots. You can take them along with you. And then also we can provide healthy foods at conferences. So if we're going to have an in-person conference, for this society, let's plan for healthy food. There was a conference I went for. And what were being served, doctors were being served puff puff. There were heaps of puff puff, at that conference. And I'm like, this contains all the great inflammators. It had puff puff will have it will have flour, it will have sugar, it will have butter. And that small puff puff contains 4 grams of fat. So by the time you are eating like 4 of it, that's 16 grams of fat. When are we ever going to burn it? It will go around the intestine. We have more people with fatty liver disease now, or we have more of high cholesterol levels. So there are things that we can actually change, that will make the difference at our conferences and our meetings. Of course, I've talked about someone who spoke throughout, while standing. We can have standing workstations or treadmill desks wherever this is appropriate. And we could get involved in community changes that support healthy living. Some of us, we are involved in associations within our estates. We can actually engage in something, or, inspire something, within the community that will make people to say, oh, let's go on a walk, a community walk. Let's measure people's blood pressures. Let's, teach people about healthy lifestyles. We can also schedule closing times on certain days of the week, maybe to close earlier, have plans for breakfast and a light dinner. Spend time walking when you get home rather than watching the news. Buy fruits and veggies on your way home. So these are little things that I've tried to do, that are very helpful. That on my way home, let me make sure I'm buying fruits and vegetables that I and my family, can eat and share. Avoid stocking your fridge with soft drinks or hard drinks, and serve visitors with healthy snacks. Let them know you that, oh, I'm a lifestyle person. I'm interested in what I'm going to look like when I'm 80, and try and sleep before 12 midnight. I know this might be difficult, especially when you're called to operate, but I know that there are ways in which we can manage our time and take on what is necessary and leave what is not. Of course, we can delegate as well. So studies have shown that physical activity can boost our mood. It can boost positive emotions. One of my friends went to Thailand and he entered a library. He shared this photo on the right with me. And so he said, in the library, if you want to charge your phone, you have to plug it where you have to go on a bicycle. And on that bicycle, it will only charge if you are cycling. So you have to intentionally cycle before your phone will charge. So that was quite interesting. That's why I decided to share this photo. And of course, we talked about our meals. Poor diet is associated with elevated BP, coronary heart disease, cardiovascular or cerebrovascular attacks, type 2 diabetes, osteoporosis, and some cancers, even without being overweight. And these are some of the meals that we see. But as much as possible, we want to encourage what we call the healthy food plates. The healthy food plate from Harvard recommends that half of your plate at every point in time should have more fruits and vegetables. And then quarter of your plate would be your carb, which could be rice, it could be cereal, it could be tubers like yam, it could be anything, it could be your swallow, but it should be quarter of your plate. And then the other quarter will now be for your protein, which should be primarily fish and poultry and legumes, less of red meat. And there was this study that showed that consuming fruits and vegetables at least 7 servings per day was associated with calmer, happier, energetic emotions, the following day. This diagram on the left here, when I launched an album, I served apples, garden egg, and granuts, as a snack. So there are things that we can do. And I think we've done this also during our lifestyle medicine week, especially when we did a courtesy visit to our chief medical director. This was what we packaged. We packaged fruits. And so at some point, my CMD asked the person in charge of the management meeting meals, that what can you do to make this food more healthier? And he said, ask Dr. Makinde how we can make it healthier, because at the end of the day, we'll be benefiting ourselves. Studies have shown that poor sleep is associated with increased levels of stress, anxiety, and negative emotions such as anger. So if you find yourself getting up on the wrong side of the bed, it might be that you didn't have enough sleep. And why is sleep important? When we go to bed, it's like wheeling in your car into the mechanic shop. Our body repairs itself when we sleep. So healthy sleep quality and duration help with DNA repair. They help with histone remodeling. I mentioned apoptosis before, as well as the development of anti-cancer cytokines, that's interleukin-1, interleukin-2, and the tumor necrotic factor alpha. So it's very important that we pay attention to our sleep. So when we sleep, it will enhance learning and memory. Short-term memory is consolidated to long-term when we sleep. We have faster cognitive processing. We have greater extinguishment of fear and anxiety. We'll be able to make better decisions. And of course, there'll be less errors and accidents. And studies have also shown evidence of lower sympathetic tone and blood pressure when we sleep better, lower cortisol, lower blood glucose, healthier BMI, even reduced food-seeking behaviors. There was a study that actually showed that individuals who had less than 6 hours of sleep on several nights, I think during a 10-day to 2-week period, they were more likely to seek out calories from sources that had more sugar and more saturated fats, at least 300 calories more compared to people who slept 7 hours. And of course, this will lead to less pill burden, less disruption of the sleep-wake cycle, and lower risk of dying. Okay, I talked about the guts earlier. Hippocrates said all diseases begin in the guts. Whatever disrupts the gut microbiome will trigger disease, because there's this connection between our brain and between our guts. So that connection is very important. So we need to populate our gut with healthy bacteria. And how do we get healthy bacteria into our gut? It's when we eat these cruciferous vegetables, when you have cabbage, cucumber, garden egg, in your diet. So the immune system, will be more likely to populate the gut when we eat some of those plant-based foods I mentioned. And then when we talk about whole foods or whole grains, you're talking about foods that have not gone through the factory where the fiber has been removed. So some of the time we choose white rice, which has, that polished rice, but it's better to choose our local rice or fada rice because it still has some fiber left on it, and that will control the rate at which the glucose in that food enters the bloodstream. But when you have a lot of glucose entering your bloodstream at any one time, it's going to heighten the amount of insulin that your body will need. And insulin is like a growth hormone. The more you have in your system, the more weight you gain. So it's good to choose the foods that have a lot of fiber. And that's what you'll find in whole grains, legumes, nuts, vegetables, fruits. And you have a rich biodiversity, of gut microbiome, when you take these foods. Sleep can also help with our gut microbiome, not only the diet. And sleep can also help with our brain. I don't think I mentioned it in passing, but studies have shown that people that sleep better are able to cleanse their brain, of certain products, that are connected or predisposed, to dementia. So I'll round up gradually so we can have time for questions. This study also talked about psychosocial stressors. They are as important as our diet. So there was this study, they call it the Interheart study, that was done by LASUTH et al. And they looked at 9 significant risk factors that were identified and accounted for 80% of the population attributable risk. But interestingly, we had psychosocial risk factors such as stress, isolation, and mental illness that were also comparable to the effects of hypertension and abdominal obesity. So as much as we're talking about changes in our diets and physical activity and alcohol, this is just to also let us know that our psychosocial health is important. And that's why I mentioned positive psychology early, which is the study of strengths and virtues that allow individuals and communities to thrive and create a support for achieving and sustaining healthy behaviors. So in essence, it's important that we have a self-care plan for eating, for sleeping, for being mindful. We can be mindful about our exercise. We can be mindful about our eating. To also control our stress levels, we need organizational skills. We also need peer support. We need to delegate. We shouldn't do everything all by ourselves. And of course, there are online resources that will be helpful. So if you want to adopt any of the lifestyle medicine interventions or strategies I talked about, you don't try to do everything at once. Just pick one area. Let me focus on one area. And then conduct a self-assessment of what we call a readiness to change using the trans-theoretical stage of change. That's what we do with our patients in my lifestyle clinic. So we check where you are, whether you're at the stage of preparation. Preparation means that, okay, we have pre-contemplation, we have contemplation, preparation, action, and maintenance. So pre-contemplation means you're not even thinking about making a change, but because you've listened to this presentation tonight, you can decide that, okay, I'm going to do something. So that takes you to contemplation. And then preparation means that maybe you've bought a pair of gym wear, you've bought a pair of canvas, and you are looking now to start exercising or doing your brisk walks, within the next 1 week or the next 2 weeks. So that's preparation. Action means you have started. You are doing something actively. You have changed something in your behavior, your diet. You are taking fruits to work. You are eating breakfast. You are sleeping the recommended number of hours. So this is very important as we transit. You can take each of those lifestyle interventions one at a time and see how they add up. And then you can also assess your personal confidence in the ability to change. We always try to find this out about this in our patients. On a scale of 1 to 10, how confident do you feel that you'll be able to make this change? Because it's not enough to just dictate and say, okay, change the way or your pattern of eating. Does that person have the ability, the confidence, and the resources to do so? So that will determine how well you'll be able to make that change. So you now develop a specific plan of action or behaviors, and you can either start or restart. Some of us might have been engaged in some of these behaviors before. We want to start. Some of us haven't been, and we are just starting. You can also have a monitoring system, a checklist. You can journal. There was a time I was on a what do we call it now? On a challenge, a 30-day challenge, and I was writing in my journal. Every day I took a fruit. I would write the kind of fruit I was eating. When I did my exercise, I would write down that exercise, and then I engaged the community also in that, and we were giving reports, every week. So if you have a monitoring system, you have a group where you can be accountable, it will help you, and you find out that this is fun. You can really enjoy it. You celebrate whatever successes you make, and then if you have challenges, you look at how you can, overcome them. So as I close, let me tell about the blue zones. These blue zones were studied by a geographic researcher. So the blue zones of the world, they discovered that they have a higher concentration of people that live longer. Okinawa in Japan, Icaria in Greece, Sardinia in Italy, Loma Linda in California, and Nicoya in Costa Rica. I'm sure there will be some places in Nigeria too. One of the places I heard about is somewhere in Ekiti State or so, where they have a high concentration of people in their hundreds, people who are over 100 years. So what they found out in these areas that were studied was that the people that lived the longest, they had 9 common characteristics. Number one, they moved naturally. That means they were less likely to drive. They found time to relax. They did what we call a downshift. They moved from a job that was highly stressful, and paid more, to one that was less stressful, even if they paid less. Whereas I know a lot of us, we do what we call shama. You do one job here, you're rushing, relax, and to rejuvenate and to eat the right stuff. Maybe that's all well and good. You don't necessarily have to do a downshift. Then, of course, they also discovered that they had a sense of purpose. They found the right tribe to engage with. They had a sense of belonging to something greater, which I believe is God, in a connection with eating. Once they were 80% full and they put family first. So these are very important things that we can put check boxes on, to be sure we are part of a community and we have a connection with God, and we maintain our connection and relationship with our family members and important people. So at the end of the day, when we have done all of this, what are the benefits? We'll reduce the likelihood of non-communicable diseases. We'll promote the clinical or healthcare practice where we are working at, because there'll be less errors and you'll be more productive, you'll be more functional, as a surgeon. You set an example for your patients, you'll be able to model what you preach. It will reduce absenteeism and presenteeism. People are at work sometimes and they're tired, they're fagged out, and they can't offer much. It improves the morale and loyalty of employees. So if you are an employer of labor and you ensure that your employees are actually taking out time to take on healthy lifestyles because they are even watching you do it, then they'll be better. They'll be better, because they are healthier, they'll also be more loyal and more committed. Greater productivity at home, at work, in the community, and of course, lower health costs. So Brian Dixon, the CEO of Coca-Cola Enterprises from 1959 to 1994, said, "Imagine life as a game in which you are struggling your balls in the air." I'm trying to juggle my daughter right now. She's just beside me. All right. So work, family, health, friend, spirit. And you're keeping all of these in the air. You will soon discover that work is a rubber ball. If you drop it, it will bounce back. But the other 4 balls, family, health, friend, spirit, they're made of glass. If we drop one of these, they will be irrevocably scuffed, marked, nicked, damaged, or even shattered. They will never be the same. So you must understand that. You must understand that and try to strive for balance in your life. So this is where I'm going to end it this evening. It's very important that we take care of our health. Our health is very paramount. If we're healthy and we can achieve that health and well-being, beyond the operating theater, and when we do that, we'll be there for our family. And at the end of the day, we'll be happier surgeons. So thank you for giving me your ears tonight. These are my references. Thank you very much. I welcome questions at this time.
Thank you so much, Dr. Makinde, for this very erudite presentation, full of quotes, memorable quotes, and I can see from the reaction from the audience and that we've actually had a very nice time with you. We appreciate your insight in this. I know the number of questions in the chat room, and as per tradition, I'd like to hand over this portion of the presentation to our international reporter, Mr. Emmanuel Gwari, to anchor the Q&A session. Thank you, sir.
Yeah, thank you so much, Dr. Makinde. And that's a very important aspect. And I think this is one of the most important presentations we've had, because most times we are so busy taking care of other people that we forget ourselves, and I think this is so important that we we take a step back to reflect on the generator of all the activities. Thank you so much. I am sure there'll be a lot of questions. And Dr. Makinde, I just wanted to find out, maybe on the corporate level, particularly when you talked about sleep deprivation, this we find out that is still man-made in terms of how we roster our juniors at work. I know in Europe where I work, we have the European Working Time Directive that has restricted working time for juniors to about 37 hours now. I don't know what the situation is in Nigeria of how long a doctor is still expected to work in a week in terms of having adequate rest times.
Yes, so I think this is something that is it's emerging. It's an emerging thing, I believe, and it varies from center to center, from institution to institution. But I know that when doctors are on leave, especially because I got some feedback recently in the past 1 week, when doctors are on leave, the burden is more on the people who are left behind, especially in a teaching hospital setting. And they will have to definitely work longer hours because they still have to serve the medical emergency, surgical emergency. So we discover that the burden actually is more on people, not only because people are on leave, but because people have left the country. And so we have fewer hands. So it's a bit difficult, to get that balance. But I want to believe that we can do a bit more advocacy, with people who are policymakers and stakeholders in our organizations to see how we can recruit as often as possible. I know that in my own institution, we've had to recruit up to 3 or 4 times this year because people are just leaving. So it's something that is emerging, and hopefully if things are better, the whole practice environment in the country needs to be upgraded so that we have people staying. So it really requires answers from different fronts. I don't think I can provide all the answers for that question.
Okay, thank you so much. And another question in terms of human factors. I know that when we talk about risk appropriation in surgery particularly, and you look at the human factors, many of these boil down to stress generated from either overwork or other, self-neglect and all that. I don't know if there are studies that have been done in Nigeria to look at this. What are the prevailing stressors or factors that contribute to accentuated human factor errors?
Yes, there are studies that show that poor sleep can contribute to errors. So yeah, the thing about it is that I found more studies, in the US, but most of the things that are happening in the US or in the UK can actually be also they are comparable to what is happening, in Nigeria. So high stress levels, especially poor sleep, those are the things that are really associated with errors. And of course, if someone is unwell and at work, the person is unlikely to give his or her best, at the end of the day. So I think it's really a confluence of all these lifestyle factors that we've talked about. But there are actually studies that highlight, how these factors can pose a risk, at work, and how people can make mistakes, and errors. And I'm sure some of us have experienced it personally as well. You know that you were not really there. You could have done it a bit better, but because you were not well rested, you were tired, you're exhausted, you now discover that at the end of the day, you wouldn't give your best and there'll be more problems.
Yeah, thank you so much, Dr. Makinde.
All right. Yes.
Yeah, we have some questions on the chat platform here. The first one is from Dr. Vincent Enemo. Who's asking, how do we measure stress? How much stress qualifies as severe stress? And what is the average sleep time that an individual should have per night?
Yeah, very. So stress can be measured in different ways, but the best way to measure it is through an objective. There are some questionnaires that we used to measure, but the way in which the person who is going through the stressful situation perceives it is very important. So there's something that we call the perceived stress questionnaire. I would try and look that up and share the link. It's a questionnaire that you can feel that will tell you how stressed you feel, because two people might be going through the same exposures, the same stressors are involved, but one person feels more pressured compared to the other person. So the likelihood of someone becoming more pressured will be higher if the person has not been sleeping well, if the person has not been eating well, and the person has not been engaged in healthy lifestyle habits, or the person has poor social connections. The person is more likely to be pressured. And so by the time the person is assessing himself, you have a higher perceived stress level. I would get out that link now and share with us so that you can determine how stressed you feel. Another way in which I determine stress among my patients is that I ask them a question that in the past 2 weeks, how stressed have you felt on a scale of 1 to 10? So there are some people that will tell you that, oh, my stress levels are very high. I felt very stressed last week. I'm giving myself a score of 8. And by the time I ask them, okay, so what do you think caused your stress? So they're now able to reflect and say, okay, it was actually because I went to the market, I had a lot of things to buy, or I had visitors in my house, my in-laws were around. So you now be able to determine what the stressor is. So that stressor, is it a temporary stressor or is it a permanent stressor? All of that will determine how to manage that stressor. So, but I'll get out that link now and share with us about how you can measure your stress levels. We call it the perceived stress scale. About the question, what is the average sleep time per night? So, yes. So we have recommendations from the National Sleep Foundation in the US. We have recommendations from the World Health Organization, and it's basically 7 to 8 hours. Should not be more than 9 hours for individuals between the ages of 18 and 65. So by the time you're sleeping more than 7 hours, there's a higher risk of cardiac of heart attacks. Studies have shown that heart attacks and premature death by the time you're sleeping more than 9 hours. Of course, for children whose brains are still growing, they are recommended to even sleep far more, especially neonates and babies. For children who are teenagers between the ages of 10 and 17, about 9 hours as well is recommended. 8 to 9 hours or 7 to 9 hours recommended for them. And children of that age, they tend to have some more issues if they don't sleep well, or they tend to stay up, especially during the period of puberty. I don't know how many of us have noticed that with our children, but once they get to that age of puberty, teenagers, they tend to have problems with their sleep. So it's very important that they also learn to stay away from devices, from screens before bedtime, because that's basically what keeps people awake. I met a woman last week. She came to the clinic because she had health issues, and she complained that she sleeps only 1 to 2 hours every night. So that's what we call insomnia. So you have adequate opportunity to sleep, but you're not sleeping. That's different from sleep deprivation, in which you are depriving yourself intentionally because you want to study, you're on call, you're in theater. So even though insomnia can also lead to sleep deprivation, but at the end of the day, when I tried to assess her sleep habits, I discovered that she was spending time on her phone. Of course, she was a widow as well. But she did all the things I told her to do. And what did I tell her to do? I said, keep your room dark. Make sure you don't have any devices in your room. Try and wind down before bedtime. Have a bath with warm water 30 minutes before going to bed. Try and do some relaxation exercises. I taught her deep breathing exercises. I taught her progressive muscle relaxation. Do you know she came back after 2 weeks? And she told me now she's sleeping. When she goes to bed by 10 p.m. and now she wakes up by 5 a.m. Someone who was barely sleeping 1 to 2 hours, it seemed almost impossible. So those little tweaks, are very important. But that recommendation is sacrosanct, because people that sleep less than 5 hours, that we have a lot of studies that show that more likely to have a heart attack, they're more likely to die prematurely. In fact, there was a particular CEO, I can't remember his name now. He used to engage himself in a lot of physical activity. He was always going on walks. He was a top CEO of an organization. He was really doing well. But one of the things he was not doing was he was not sleeping well. He was sleeping less than 5 hours. He had a heart attack. So he was paying attention to all the other areas, but he was not sleeping well. And he died of a heart attack in the prime of life. So these things are important. 24 hours doesn't seem to be enough. But there will be a time you're going to retire from active work, and at that time, your health and your quality of life will be more important. Are they going to be pushing you around in a wheelchair? Or you're going to be visiting your grandchildren, providing words of wisdom for people around you, people coming to you for mentorship? What exactly are you going to be doing in those years? Are your children going to be carrying you back and forth, between cardiovascular surgeons and, so let's look at the end goal at the end of the day. Sorry, that was a very long way to respond, but I can see a question saying, must we always undertake afternoon sleep to alleviate stress? No. So there's something that we call a power nap. You can take a power nap, which should not last more than 30 to a maximum 40 minutes in a day. Some people even say 20 minutes. A 20-minute power nap can restore energy levels and reduce fatigue. But you should take that power nap before 3 p.m. between the hours of maybe 12 noon and 3 p.m. Don't take it after 3 p.m. because if you do, you're going to push back your biological clock. You're going to disrupt your circadian rhythm. And so when you want to sleep at night, you lie down on the bed and sleep will not come because you have pushed back your biological clock. So yes, the power naps are very helpful, especially for a very busy surgeon. Yes, but don't do it after 3 p.m.
Thank you very much. I hope we are all taking this in. Maybe an interesting thing we could do is a straw poll to find out how many of us take up to 7 hours sleep per night. If you can just indicate by a hand raise on the Zoom. Let's take a quick straw poll. The next question says, in the meta-analysis on incidence of stress among surgeons, was there a reason alluded to as regards stress level highest among ENT surgeons? Please, what of the general surgeons? I know you did say there was no study including colorectal surgeons in the study. But from this study, was there anything that highlighted ENT surgeons to be more stressed?
Yes. Let me share that with us. I think I will just share that study with us so that maybe we can check it out. I can't say exactly now what the factors were.
Yeah, maybe we could share
I
that.
think
We could share that later. Yeah, we'll be grateful if
okay.
we could have that shared on the platform later.
Okay.
Yeah, thank you. And
Okay.
Dr. Ghana is also asking a question. Says, great talk, Dr. Makinde. A little clarification on the study involving healthcare workers. What was the comparator, the general population or lifestyle practitioners?
Yes. So sorry, my daughter is trying to get some information from me. Just hold on, I'll be right back.
Okay.
She has been trying to get my attention for a while. So, but I'm just trying to let her know.
we understand.
I know sometimes.
Yeah.
Sorry, could you come again on that?
Yes, it says a little clarification on the study involving healthcare workers. What was the comparator, the general population or lifestyle practitioners? So when you were comparing the healthcare workers, the
Yeah.
comparator, were they the general population or lifestyle practitioners?
Okay. Yes. Okay. I've just gone back to that slide. Healthcare and lifestyle practice of healthcare workers. So healthcare workers practice what they preach. Yes, I think it was actually a comparison between healthcare workers and I think the general population. Yes, I think there was something I missed out actually from that. But I'll make sure I include it when I'm sharing the slides. I think there was something missing. There was another slide that I missed out that showed some of the comparison, some of the outcomes. But it was supposed to be between healthcare workers and general practice. Yes, and general populace. And there was no difference.
Yeah, thank you very much. And there's a question from Clementina, and it says, when we talk about physical activity, can the time we spend moving up and down at work, attending to patients and doing procedures count for physical activities?
That's a very good question. So it counts for physical activity. However, it might not count for moderate intensity physical activity. That was something I didn't mention. So the WHO recommends 150 minutes of moderate intensity physical activity every week, 150 every week. That's a minimum. And you can go to a maximum of 300 minutes. So that's like 30 minutes to 60 minutes on 5 days of the week. But when we're talking about moderate intensity physical activity, it's something that makes your heart beat faster and makes you breathe faster. And we use the talk test to determine whether you are breathing faster or whether you are actually doing moderate intensity activity or vigorous intensity activity or mild intensity activity. So mild intensity activity is a stroll. You're walking at your pace. You're not moving fast. But moderate intensity activity means you're walking fast as if you're late for an appointment. I don't know how you can do this in a workspace. You know, you might be able to walk a bit fast, but how fast can you walk? Can you walk that fast for 30 minutes? You know, and because what we are trying to do at the end of the day is to prime your cardiovascular system to improve your cardiovascular resistance, you know, and reduce your risk of hypertension. So the talk test, the way in which it will help you measure to know whether it's moderate intensity activity is that as you are walking fast, you can talk, but you cannot sing. You can talk, but you cannot sing. So you're walking fast. One of the ways, you know, you pick up your pace in such a way that, if you start singing at some point, because you have to catch your breath, you can't sing. So that's moderate intensity activity. But if you are doing it vigorously, for example, now, if you are swimming very fast, or you are skipping, or you are running or jogging, it's unlikely that you'll be able to sing because you are just trying to catch your breath. So that is vigorous intensity activity. You won't be able to talk and you won't be able to sing. But for mild intensity, you can talk, you can sing. So if you are going about your regular activity at work and you discover you can sing while you're doing it, so that's not moderate intensity activity, that's mild. So that's why it's good to create a separate time during the day when you go for your exercise so that you can engage in that recommended amount, you know, of moderate intensity physical activity. I hope what I said is clear.
Yeah, that's very clear. Thank you so much. I think I skipped a question earlier on from Dr. Adeye, who says, what is the role of smartwatches and other tech devices in facilitating a healthy lifestyle?
Yes, they play a role in monitoring. You know, we talked about monitoring ourselves, accountability. So that's personal monitoring and accountability. They help you, they just send you reminders and tell you how well you have done so you can celebrate yourself. Your phone can tell you how many steps you have taken. If you check your phone and you've done 10,000 steps, you'll be excited, you celebrate, and it will help you to be more inspired, to take those kind of steps on another day. And sometimes those smartwatches will also beep. If you have sat down for maybe up to 20 or 30 minutes, you have a beep on your smartwatch that will tell you it's time to move. And so even if you didn't want to move, you start moving. I remember during the COVID year, I had a lot of presentations like this, and we were not going out, so I found myself sitting a lot. So one of the things I did was to set my timer. If I was going to sit to prepare a presentation, I would set my timer to every 20. So it will buzz. And what I told myself was that at the end of that 30 minutes, I will stand up and do 10 jumping jacks. So once it's 20 or 30 minutes, I'll stand up, I'll do the jumping jacks and sit down again. It will buzz again. Even sometimes I'll be annoyed. Oh, why did I set this thing? But I'll say, okay, I have to do it. I have to be accountable to myself. I promise myself I will do this. So I'll stand up, I'll do 10 jumping jacks and come back and sit down again. So it's just for accountability and personal monitoring, but it really does a lot, to help us facilitate a healthy lifestyle.
Thank you so much. There's a question from Dr. Babajide Oladaya here. He says, is it possible in the face of nationwide depletion of medical workforce to have flexible rotas such that doctors are given a day off after 24 to 48 hours of call? Thank you for your presentation.
Yeah. Certainly. I think it starts with us, really. Maybe some of those association meetings that we have, people go on strike, because they want better facilities, they want better remuneration and all that. We can come to a roundtable and include some of these things that we're talking about in what we really want. We can create that workspace for ourselves where people go off. I think it's happening already in some places. I think it's very possible, to have
and
those.
I think the seniors should really take the initiative. A situation where somebody does a 24-hour call and is still expected to work the next day is just, well, we did it as junior doctors, but now when our trainees can't imagine how we survived those days. If you are on night, you don't come to work the next day. If you're going to do night, you don't come to work during the day. So things are happening, but I know there's a paucity of labor of doctors, so that's creating difficulties. But it's only doctors that are alive that can actually do the work. So we need to take care of what we have, and find out that these stresses are part of what is, driving people up. So I think it's something we will benefit from in the long run, but we just have to start considering it. I know as a trainee, this was never part of the conversation, but this is just real life now. If we want our doctors to be healthy, if we want to reduce errors, if we want the quality of life to improve our longevity, we need to look at all this holistically. I think it's important.
Certainly.
Yeah. And Dr. Grace Ake, I don't know, she's asking this question, 7 hours at a stretch, what a luxury. So that's just
yeah, so it's a luxury. It's a luxury, but it's actually not a luxury. Do you know? It's not a luxury at the end, because your DNA, that's when your DNA repairs itself. That's when a lot of things go on. That's where your ghrelin, we talk about ghrelin and leptin levels, They're the ones that are responsible for your controlling your appetite, and eating and, controlling cravings. So a lot of things that we don't have control over is because we are not sleeping well. But when we sleep well, we have better control. You'll just find out that those cravings will not be there. Your insulin sensitivity is better. Your blood pressure is better. So many things are better. You're able to recollect things better. Many of us remember in medical school, the times when we didn't sleep, we did TDB, and you went for an exam the next day. Some of us ended up with mental blocks. You couldn't remember anything. So sleep has never been something that is a necessity, not a luxury, I must tell you, and it's free. Many of the things that are necessities that which we deem as being luxuries, the way God has designed them, we can get them freely without paying. You don't have to pay anybody to sleep. You don't have to pay anybody to breathe in fresh air. You don't have to pay anybody to eat good food, really. Of course, you have to pay for the food or buy the food, but at least eating, except you are sick, you can eat by yourself. So it seems a luxury. If you cannot take all the 7 hours at once, try and take at least 6.5, and then have a nap during the day. We're talking about consistency here, something that you're going to be doing for a long time. So there might be some times when you cannot take the 6-7 hours that we're talking about, but those should be far in between. It shouldn't be all the time. When we're preparing for major exams, of course, you have to stay awake, you need to study. But we're talking about the long-term habit or behavior. So let's plan for the 7 hours. Our body really needs it.
Thank you very much. And Dr. Olatunbo Suoke made a comment here. He said, from experience, moderate intensity activity is extremely difficult to achieve at work. For me, I have set aside time every day to achieve those minutes of at least moderate intensity exercise. Well done. And Dr. Gray says perhaps gym work from 6 a.m. before work. So that brings my other question, Dr. Makinde. High intensity exercise in the morning or in the evening, which is more beneficial?
So it's actually what works for you, but as much as possible, don't exercise within 2-3 hours of bedtime. As much as possible. That's what studies show. They show that if you exercise within 2-3 hours of bedtime, you are still going to be very alert and you might not fall asleep as readily. But I've had a few patients who will tell me that when they exercise just before bedtime, they sleep better. So it depends on really what works for you, your schedule, your timing, and all of that. But when you expose yourself to early morning sunlight in the morning, and you exercise, it actually enhances, productivity and performance. But you could still get some benefits when you do that later in the evening.
Okay. Thank you very much. And Dr. Augustine Ratulam made a comment, and he says, here in Italy, we have a group of doctors in public hospitals that ensure every doctor is healthy. Can we introduce it in Nigeria?
Okay. I believe so. You said you have a group of doctors in public hospitals that ensure every doctor is healthy. Yeah, that's interesting. So, now I have a question. We have MD Can, we have the Medical and Dental Association, Consultants of Nigeria, Association of Nigeria, Medical and Dental Consultants Association of Nigeria. So maybe we could use MD Can. In my own institution, there was a time that we had an AGM and scientific meeting, and everything was focused, on healthy lifestyles, calling doctors, to take that call to action to change their lifestyles. But, because we are busy, following up on one another is not that easy. But the Society of Lifestyle Medicine of Nigeria, of which I'm the president, what we do is that we have webinars once a month. We try to get people together, teach principles of lifestyle medicine. We have an annual conference. We collaborate with other organizations and other associations, just so that this message we keep telling ourselves, how to adopt healthy lifestyles and just do it consistently. But if you already have a forum that does this and checks up, on doctors, I don't know how that's really going to happen. But what I'm familiar with is having either you have a community on WhatsApp and you do things together at certain times, you have webinars at certain times. I don't know how it would be going from hospital to hospital, but there's nothing that is impossible. So far as there is a strategy, we have focal people who will be in charge. But if you have a way in which it has been done in Italy, maybe we can follow that strategy, and bring it home to Nigeria. So I think it would be good if you share more of how that works out. But what we are doing here is what I've just shared.
Thank you so much, Dr. Makinde. As you were talking, I just remembered a speaker was talking to a group of preachers recently and about well-being and lifestyle, and he mentioned that preachers are so busy about the work of God that they have forgotten the God of the work. And sometimes we have to be careful that we are not so busy about our work that we forget about the engine that produces this work. Because if you drop tomorrow, somebody else will do that work. Nobody is irreplaceable, and you just have to remember that, and remember that you have a family, you have children, you have your own life to live. Some people, let's not chase money to the point that when we are now sick, the money we are spending the money to take care of our health. So all these are things where we need to take particular attention or pay particular attention to. Life is precious. We should mind it. I remember the scripture saying something, said your body is the temple of God. You were bought at a price. Therefore, glorify God with your body. So we need to mind this body. That's the only one we have. And I just want to thank Dr. Makinde. And I think this talk is so important. Maybe we should try and make this once or twice every year, because this is the only one that addresses us particularly. Every other thing is how to optimize patient care. But this is how to optimize ourselves to be able to take care of our patients. So I want to thank you again on behalf of the association, and I'll just hand back over to Mr. President. Thank you very much once again, Dr. Makinde.
My pleasure. Thank you so much for having me.
Thank you so much, Mr. Egwari, for anchoring this Q&A session. It was very, very interesting, and I'm sure we all have taken lots of points to reflect on and to improve on our own personal well-being. Also, we're very grateful again for Dr. Makinde for taking time out to prepare this presentation and to share her thoughts on this very important aspect of our own personal well-being, to make sure that we have longevity and continue to serve ourselves, our families, and our patients. And like I said earlier on, this meeting has been recorded and will be available on our platforms and shortly after being edited. And for now, there are no clear-cut announcements from the school, but there will be some updates that are presented on our WhatsApp platform in due course. And please do not forget to fill the attendance form. The link is on the chat form or chat function of this webinar. Again, I'm very grateful for everyone who has taken time to attend. At the peak of it, we had over 40 people, which is quite significant on a Sunday and a topic that is not our routine. I'm sure that people will catch up with the recordings and definitely there will be some insights. Again, if we need your services or need to engage you, I'm sure Dr. Makinde will be more than happy to link up with us in the future. And we look forward to more collaboration with you and your society. Thank you once again for this. Thank you to everybody who has attended, for those of us who have also giving out questions and comments, and for the robust activity we had over here. And we're also grateful to our elders, to our teachers, and to the BOT for their continued support of the society. Again, on behalf of the Nigerian Society for Colorectal Doctors, I'd like to wish us a happy night's rest and a fruitful week ahead. Thank you once again.
Thank you. Good night.
Thank you. Good night.